In the Ashanti region, health authorities are stepping up efforts to reduce maternal mortality after the region saw a reduction in cases last year. Our regional correspondent, Doris Lonta, reports.
In 2022, the Ashanti region recorded 181 maternal deaths, which rose to 217 in 2023. However, in 2024, the region saw a reduction in cases, with 185 deaths reported. Speaking in an interview, the Ashanti Regional Health Director, Dr. Fred Adomako-Boateng, emphasized that the Directorate intensified its efforts to reduce maternal deaths in 2024. He disclosed plans to establish a maternal and perinatal task force to coordinate activities aimed at further reducing these cases.
If you look at our data coming from last 2023, we had an unusually high maternal mortality if you compare us to the other regions. But looking at 2024, you can straight away see a reduction in the maternal mortality. We are anticipating that even as we go into 2025, we are going to reduce it furthermore. A lot of interventions have been put together. One crucial one that we have really looked at, one crucial one that we have really looked at is the coordination of maternal health.
Dr. Adomako-Boateng elaborated on the task force's activities and how they will support the Directorate's goals in tackling maternal and perinatal mortalities.
With the core duty of the maternal and perinatal task force, what we are going to do, there are some interventions that have been put in place to make sure that the deaths that are preventable do not occur. So some of the deaths, no matter what you do, but some of them are preventable. So why should a death that a mother dying from a death that could be prevented die from it? That is the focus of the maternal and perinatal task force. Their duty is that any deaths that occur, one, we will have to look at it. We call it audit it. And when you audit it, the gaps that you see, you make sure those gaps do not occur again.
Additionally, Dr. Adomako-Boateng appealed to chiefs and traditional authorities to collaborate with the Directorate by providing accommodation facilities for health workers in their respective districts to enhance healthcare delivery in 2025.
After touring the 43 districts, there are some challenges. At times that is beyond health. For example, we went to Drobonso. That's such a Fran Plains. We have been to Amansia South, Amansia West. Look, we have nurses, but where even to post them because of accommodation? One key thing that we want to do after the tour is to meet the traditional, it's part of the report that we are doing, to meet the opinion leaders, other relevant stakeholders, traditional leaders, that look, we have the staff, we're able to give them to you, but we don't have accommodation. What can we do? How can they meet us halfway?
Officials of the Ghana Health Service say they are putting in measures to further reduce cases of maternal mortality. Reporting for ChannelOne News, I'm Doris Lonta, Ashanti Region.